We are recording.
I think we have critical mass, First Lady.
Okay, hello and welcome back. I think we are today will be should be a little shorter, which is exciting, and that's because we are on the home stretch. I don't have to say it's recorded because we did that already. We're going to review the two new action plans from the subcommittee, and then we'll be discussing next steps and then some stuff around the upcoming legislative session. And before we want to dive into the agenda, I'm excited to just update that we recently had a field visit. The Behavioral Health Talent Council folks were on the road. Julie Ibrahim and Liz O'Connor and the governor's team were meeting with AFSCME members who are frontline behavioral health workers from across a couple different organizations. It was incredibly helpful to hear people talk about the current kind of struggles and safety concerns and just things that people are dealing with from both residential settings all the way to community outreach. People gave recommendations around some things that that could be happening better, and also just how we can prolong the careers of these folks. They talked a lot about, acknowledging risk that people take, as well as having a voice on the job, and making sure that people feel respected and supported, as there's a lot of compression in services right now and upcoming budget shortfalls. And just always a good reminder about how that is impacting clients and providers as work is hard and the uncertainty is harder. And so really grateful to folks who gave voice to that. It was really a great way to spend time, and we were happy to do it. And with that, I'm going to jump into the agenda and keep us moving along. The first action plan that we're going to do is recruitment and retention incentives. And Julie is the vice chair of the recruitment and retention subcommittee, is going to walk us through.
Thank you, First Lady, and thank you, Chad, for helping me with the slides. Good afternoon, everyone. I'm going to present the Incentives Part 2 Action Plan for the Recruitment and Retention Subcommittee. Next slide, please. The purpose of this plan is to expand access to supervision and licensure support, create incentives for career advancement, and integrate career pathway information into a workforce website. There are 3 focus areas for this plan. The first is to improve recruitment and retention of behavioral health providers in rural and underserved communities. The second is to reduce financial barriers for providers with families, particularly related to housing and childcare. And the third is to support equitable access to behavioral health services across geographic and demographic lines. The lead on this plan is OHA, and also keep in mind that this plan was categorized as due last or due third. I think it was due third, maybe. Anyway, it had a lower prioritization due primarily to the fiscal requirements that would be required. Next slide, please. Now, there are 3 strategies for this plan. The first is to support childcare access for the behavioral health workforce, the action for which is to propose a statewide childcare subsidy or tax credit for providers with dependents in rural areas. The second strategy is to fund relocation and housing stipends, the action for which is to develop a grant or stipend program for relocation and housing support for new hires in rural and remote areas. And finally, the third strategy is to align incentives with workforce shortage data, the action for which is to use existing work shortage and unmet need data to prioritize the funding. Next slide, please. Now, there are 3 outcomes for this plan. The first outcome is a legislative concept and implementation plan. The goal for that would be increased recruitment and retention in rural communities. The second outcome is program guidelines and a policy option plan, package with the same goal of increased recruitment and retention in rural communities. And the third outcome is data-driven funding decisions, the goal of which is a targeted grant-making process to address inequities in workforce recruitment and retention across the state. There are 4 equity opportunities that we see for this plan. Next slide, please. Sorry. 4 equity opportunities for this plan. The first is to expand access to behavioral health services in rural and frontier areas. The second is to reduce disparities in provider availability for culturally and linguistically diverse populations in rural areas. The third consideration is to ensure that financial supports are accessible to safety net and community-based providers, not just private practices. And then finally, to consider higher incentives or tax relief for rural and remote regions, tribal communities, or areas with significant unmet behavioral health needs. Next slide, please. In terms of implementation considerations, there are 3 anticipated barriers. The first is the obvious cost of this plan, which will require legislative appropriations. This is one of the main reasons that we've classified this as a lower priority in our council recommendations. The other barriers are the operational complexity of implementing and coordinating these initiatives across the state. The timeline for this plan is approximately 6 to 12 months for most of the deliverables, with ongoing evaluation and refinement as required. Okay, any questions or comments? Okay, well, I'll turn it back over to you, First Lady.
Actually, can I ask a question? I'm sorry, I didn't put my hand up. I was having
Sure.
challenges. So I guess the only question I have is in the subcommittee, the discussions around, I'm sure the already kind of work that's been done in the legislature to talk about childcare, and what is already being used there and what the challenges are, if that was already discussed, when you came up with the one you came up with.
As I recall, I don't think we discussed that in much detail. And because this was a lower priority plan, we didn't have extensive discussions on it. So I would say the answer to that is probably no.
So then the only other thing is, I know conversations in the legislature around tax credits can be challenging. So I would just say that that's probably it. When you have one, it's harder. We do often do tax credits for, say, nurses and nurse practitioners in rural areas, and that is one of the tax credits that everyone is supportive of, but I know it is a challenging discussion.
Yes.
Okay.
Thank you. Okay, thank you.
I would just say only one other just point is that, when I traveled with the governor for the One Oregon tour, housing is a problem everywhere, but I just want to give voice to the importance of it can be really hard to move to a place to become the clinician if there's not a place to live. And so when we think about order, that was a huge thing in that we want to recruit people, but also if there's no place for them, there's not even an opportunity for people to get started on the job. And so I just wanted to kind of put that out there, that it was something that I know as particularly in rural areas, as people are thinking about recruitment, those things were connected. And housing is obviously a challenge everywhere, which is why it's a priority for the governor. But I just wanted to kind of highlight that because we heard it everywhere.
Yeah, we discussed that a lot, and also the fact that even if you have money for childcare, it's often not available, period, or not enough of it anyway.
Okay. Anything else? Any other things you want to say, discuss, or if not, we'll move on to the next one. Okay. Sarah, are you ready? Okay. So next I'm going to hand it over to Sarah Means, and she's going to talk about workforce, higher ed. She's that workforce, higher ed, and economic development advisor to the governor. She's fantastic, and she is going to step up and present on career exploration and professional development. You are on mute. This happens to all of us, me especially. You see you're off mute.
Sarah, we can't hear you if you're chatting.
How was that?
That is amazing. That is the sound of relief. Great job.
It is the sound of relief.
You're doing great. Thank you.
All right. Thank you, First Lady. Today, I'll be presenting on career exploration and professional development action plan developed by the Education and Training Subcommittee. This plan focuses on building equitable statewide opportunities for behavioral health career exploration and ongoing professional development. Chad, next slide, please. Okay, so this action plan aims to create a seamless, inclusive career pipeline from early exploration to advanced professional development. We're prioritizing clarity in career pathways, support for rural and culturally specific communities, and continuous feedback to ensure relevance. The plan also emphasizes continuing education unit CEU, eligible training, and mentorship to strengthen workforce and workforce retention. Next slide, please. So some key strategies in this plan, we're proposing to set up a coordinated strategies to make behavioral health career pathways more visible, accessible, and supportive. First, we want to broaden career exploration starting as early as middle school. This includes job shadow career days and a statewide roadmap for internships, all aligned with Department of Education's Career Connected Learning Framework. Second, we're working to clarify certification and licensure pathways. There's a lot of confusion around roles. I'll speak for myself, but like CADC, QMHA, LPC. We're proposing to collaborate with credentialing bodies to create clear, user-friendly guidance and integrate that into advising systems. Third, we're expanding professional development, offering continuing education unit, the CEU eligible training in areas like cultural humility, digital literacy, and evidence-based practices. These will be modular and portable to meet the needs of rural and multi-role professionals. We're also prioritizing support for rural and culturally specific agencies. This includes technical assistance and funding to help them offer mentorships and career-connected learning. And finally, building continuous feedback loops through advisory groups, surveys, focus groups, forums, to ensure our efforts stay responsive and community informed. Next slide, please. So some outcomes and goals here. We're being a little ambitious, but that's necessary. We want to ensure that every Oregon student has equitable access to explore and enter behavioral health careers, starting early, continuing through advanced degrees. We're focused on making certification and licensure pathways clearer and more navigable. Um, so students and professionals can confidently pursue their goals. By expanding professional development, we'll improve workforce readiness and retention, especially in underserved areas. We're also committed to strengthening rural and culturally specific participation by supporting local partners with the resources they need. And finally, we're building a responsive system, one that adapts based on feedback and collaboration across education, workforce, and credentialing organizations. Next slide. In terms of equity opportunities, we're embedding culturally responsive learning throughout the career pipeline from early exposure to ongoing professional development, addressing structural barriers that disproportionately affect rural, BIPOC, immigrant, and first-generation students, things like cost, geography, lack of representation. By expanding mentorship and early exposure, we're helping students and professionals see themselves in behavioral health careers. And ultimately, our goal is to build a workforce that reflects Oregon's diversity and delivers culturally relevant care to every community. Next slide. Yeah, last slide. Great. So obviously, implementation considerations and barriers, these will look very familiar from prior conversations. Obviously, funding and resource constraints and data and technology constraints are all considered barriers here, and also digital equity and accessibility gaps. The group expected to be able to deliver on these deliverables within 3 to 12 months for most of them. And of course, as I've mentioned already here, ongoing evaluation and refinement is essential. So I will, if Chad can stop sharing there. I also just want to acknowledge that Shali, what the heck, a great partner in all of this work, is here. If you have any questions, and anybody else from the group, please chime in if there are any questions. But thanks for allowing me to present. Oh, I see a hand. Rachel.
I guess I'm going to be the annoying one that asks questions today. So one of the things that's interesting is about you have a rural area so that you can gain all of these higher education opportunities. Um, but often a rural area isn't necessarily where the person works. The rural area has to go to where the person works. And so the zip codes are different. And I know this is challenging. And I just was wondering if it was something we're looking at as a state, if other states have done it, or if it is like you can't do it, right? So I'm one of the people that appointed FQHC and rural and did rural loan repayment. And I know that is one of the barriers. So I don't know if that came up at all.
I am trying to recall our conversation. I'm not sure. I mean, loan repayment is, yeah. That's a topic of conversation in many areas of, specifically as it relates to higher education. I don't know, Shelley, if you remember if that came up in this particular conversation.
I don't believe
I
it
don't think
did,
so. Yeah.
not to that level of detail anyway, but really valid point.
Yeah, and I just wonder if any state's been able to do it or if it's just
Mm.
any money are not able to do that. I think it would be interesting to explore.
Yeah. Thank you.
Thanks.
Any other questions or discussion? Okay. Here's my question. Do people want to I think we're going to have a shorter meeting today and we knew that. You get some time back. The question is, do you want to take a 15-minute break or a 10-minute break? Or do you want to continue to move through and get done earlier? Keep rolling. Oh, that's a good one. Do people feel like oh, I love this. Thank you, Dr. Gates. I think if that's okay, I think then people can have more of their day at the end. If that, and I think staff is probably prepared to keep going. Love it. Okay. And then just as a reminder, by the time things come to the council, unless there are major revisions or discussion, they're going to be adopted and move forward. And then what we're going to do now is talk a little bit more about the next steps. And this is where governor staff, Taylor, Hannah, Casey, Danny, all of these fabulous folks, you're going to get to see and hear a little bit about how we're gonna take this work to the next place. And just before they do, as always, I want to thank you for the work that you've been doing. The conversations that have been had in the subcommittees have deeply informed the way that we're thinking about workforce, we're thinking about education. The governor has been paying attention to this council as all the other councils that she's put together, and has been able to consider legislative concepts based on the robust conversations people have been having in the subcommittees. And so I look forward to have staff walk you through that. I'm really excited for the opportunity to continue to work together to advance one post-report in whatever ways we do that via legislative session or administrative rule, and having as much involvement as people are interested in. You are the best spokespeople for this work, and it is an honor to be among you. And so with that, I am going to hand it over to staff.
Thank you, First Lady. So I will start, and my job here today is to talk about the next sort of 6 weeks for the council and what the look ahead is so that you all know what's coming. So first, I'm going to start with the next 3 meetings and say that as of today, with the discussion of the last 2 plans, you all have advanced all but 3 plans that will be coming forward at the January 8th meeting. So those remaining 3 plans are one focus on workforce supports that will have been informed by some incredible feedback from frontline workers. You'll also have 2 plans that are specific to culturally specific supports that will be coming from subcommittees during that meeting as well. And the governor's office team has been working on doing outreach to culturally specific organizations on the plans themselves, and will be prepared to kind of share out the feedback that they've received and some potential ideas for discussion as a group. So that will be the January 8th meeting. January 22nd meeting will actually be the first time that the council will review a draft of the report, which is very exciting. So the report draft is going to include background about the council and the charge, bios for all of you. So Chad has reached out to make sure we have your most updated bio, but that'll be an opportunity to see all of the action plans that you have advanced, sort of summarized and then linked in the report as an opportunity to provide feedback. That will also be a great time for you all to see how the chair and the vice chairs have incorporated the discussion that has actually come up about action plans during the subcommittee meetings as well, just to make sure that nothing was missed and that the discussions are well represented and how the plans are presented in the report. And then January 29th will be the report coming forward for adoption, just in time for the January 31st deadline to get the draft report to the governor's desk. So that is sort of our look ahead for the next 3 meetings for the full council. So happy to take questions about the next steps there before moving into what happens after.
I'm sorry, I'm going to stop here.
Oh, thank you.
Mostly just to say thank you so much to Taylor for keeping these trains running on time. I mean, it is incredible. It is just the incredible amount of work. We have so many amazing people, but our ability to make all of these timelines work together, it just could not be done without Taylor. I think some people didn't think it could be done, period. And we know why. And so before we do anything else, I just want to say thank you so much. We have just all been so grateful.
Taylor is amazing. And your whole staff is amazing, really. And I also want to say the OHA staff that have supported us in writing these plans. have done an outstanding job.
Well, thank you so much. It truly takes a village, and I'm only supported by the very, very best, and Chad and the whole governor's office, HEC, and OHA teams are the heroes behind getting us to this look ahead. So thank you so much for the acknowledgement. I very much appreciate it. So with that, if there are no other questions, moving on to what happens after the final report is considered. It goes to the governor, and she will review it and make decisions about, in her role as governor, the recommendations that she would like to advance. And we will make sure to keep the council apprised of what she decides to move forward. And I think the conversation today is already the beginning of that discussion. So that's what happens after the plan goes to her desk, or the full report. First Lady, anything I missed before we start to transition to the next portion of the agenda?
Nope.
Excellent. Okay, so with that, let's see if Danny is here.
Taylor, I think we had one other little thing.
Oh, Hannah, I'm so sorry. Yes, go,
No,
Hannah.
you're good. And I'll just give Danny a second. Danny's running over here since we're going a little quickly through our agenda. So I will first just have a little note. Hi, my name's Hannah C. I've gotten to meet a lot of you. I work on the communications team within the governor's office, and it's been a pleasure working with so many of you that I've gotten to know. I just wanted to let you know that in preparation for the final report, I will be sending out a form to your emails to collect little meaningful learnings, moments of collaboration, maybe breakthrough moments. These could be conversations that you had on subcommittees, or maybe you went with the First Lady to a visit, or a roundtable. Maybe you had a callback to an experience you've had in the field and shared that with your subcommittee, and that sparked, something for the recommendation. So any little tidbits that would be able to help kind of put your voices and the personal touches of this group of experts into this plan would be super appreciated. We're going to weave in some of those anecdotes into the final report. They'll be kind of mapped to the specific action plans that they relate to, and they'll be put on the page as little pull-asides, contextualizing these policy recommendations and where they were sparked. So I would love if you would participate and collaborate in that effort. That'll be coming to you soon.
Thanks, Hannah. First Lady, would you like me to hand it over to Danny, or would you like to?
No, you're good. Danny, thank you so much. I see that you are Danny on the go. Thank you for doing this. Hopefully it's okay. We're running ahead of schedule, but we really appreciate you.
Oh, thank you so much, First Lady, and just hi everyone. Yes, from a call. So if the connection gets weak at any point, please let me know. But this hotspot seems to be working effectively. Any challenges so far? Are we okay?
We're doing great.
Great, great. Well, my name is just for introductory purposes, my name is Danny Moran. I'm Deputy Legislative Director in the Governor's Office. Thank you again for having me. Thank you for all the work you're doing as part of this council. I know you're going to get an update from Casey on our team about how the Governor's Office is exploring legislative changes for the coming session, including specific council recommendations that support the behavioral health workforce. So I just wanted to come on first and provide some context on the legislative process for the upcoming short session. And I know there's some people on the call who have a ton of legislative experience. There's some who, maybe this is some new information. So I just wanted to give a high level overview of deadlines and processes so you have a sense of what the coming months will look like. So the next session will start in February. But there's obviously a lot of work that has to be done ahead of that time. So the first big deadline that we really came across in the build up to the session was the deadline to submit legislative concepts for drafting. So that was on November 21st, which was one day I know after the Talent Council advanced your first action plan. So that initial deadline, where you basically submit language to legislative council, the attorneys who work with legislators, the governor's office, agencies to write the bills, that's when they need that initial information, because they basically have a short time frame to write hundreds of bills to get ready for the session. So that's why those deadlines were so tight, and why information had to be submitted when it was. Casey will get, like I said, into some more of those policy details, but that's just an essential part of the functioning of the legislature to be able to keep things moving there. Just some additional context on what you will probably see now in the weeks ahead. The short session, which takes place in even numbers years, is very different from the long session that we just got out of last year. It's different for a few different reasons. One, unlike the long session when Any legislator can introduce any number of bills. Agencies can introduce bills. There are actually pretty strict bill limits for this coming session. So the governor can introduce up to 3 bills, including this one that Casey will get more into. Agencies can introduce legislation directly, and legislators get 2 bills per person. There's also what are called committee bills, where chairs of policy committees can introduce up to 3 bills that are sponsored essentially by their own committee. So it really does narrow the universe of what's on the table. And a big reason for that, obviously, is that the short session is only 5 weeks. Compare that to the long session, which is about 5.5 months. So there's the same public process. Every bill needs to have at least one public hearing before it can be voted out of its policy committee in a work session, where it will move to either the big budget committee called Ways and Means or directly to the House or Senate floor for a vote. So those rules are all the same, just the deadlines are much, much tighter. So I would compare the long session to a marathon where things can start a bit slowly and there's more time to get acclimated. This is really just a sprint from the jump. And that also impacts for this legislation, if there's any kind of amendment needed, there's really only one chance to do that, to be able to kind of meet the legislative deadlines that are required for the 5-week session. I will get a little more into just some of that process and more of what those specific deadlines are. The next date that I do want to just alert folks to, though, is January legislative days. For folks who are not familiar, these are the days when committees, policy committees will meet outside of the legislative session. So that will be from January 13th to January 15th. And particularly the one that comes right before the legislative session is when you'll really start to see what policy chairs are teeing up for their agenda. And I would expect this concept to be vetted in a policy committee, or at least have a conversation about it in a policy committee during January Ledge Days. So we will get more information out to the council when we know more details on that. But just for those who are maybe newer to the process, wanted to flag the Senate Committee on Early Childhood and Behavioral Health and the House Committee on Behavioral Health as the 2 big committees that deal with policy in this area. And again, if I'm repeating things that folks already know, I just want to make sure that everyone's got the same grounding. So those are the initial deadlines. I would say that February 2nd is obviously the start of the session. That's when bills will be formally introduced and assigned to a respective committee. Bills will become public on OLIS, which is the Oregon Legislative website, probably that week before session. So late January is when you'll see everything online, and we can always get out more information on how to access that if people are newer to that process. And then there are some really tight deadlines for when bills have to get out of their policy committee. You have about 2 weeks to go out of that first committee, get to the House or Senate floor, go across chambers, and get everything done by March 8th. So I don't want to belabor it. I can get you maybe in the chat some more of those specific timelines, like I mentioned. But it will be an interesting session for sure. We've got obviously in the negative space, I would say the challenges caused by HR1, the big ugly bill that came through at the federal level, which will be impacting budget conversations. So I anticipate that being a theme that you'll hear about this session and impact what legislation can make it across the finish line. I will say, to end on a positive framing, the building is opening up in ways that it hasn't for a number of years, because all of the construction that's been going on and making life very difficult for legislators and advocates is wrapping up. So the building will be much more open. Like I said, I will make sure to get these specific deadlines to you for awareness, and I also am happy to take any questions, but if there aren't, I will turn it over to Casey. So just again, thank you for your time. Really appreciate it.
Great job, Danny. That was a great overview.
Hi, everybody. I'm Casey Liddell. You already know me from my various presentations. I am going to be talking today about sort of the content of this legislative concept that we have been working on. And that is sort of the legislative concept is what you call it when it's not a bill yet, but it is being drafted by Legislative Council into a bill. So as Danny mentioned, we're kind of in the short session timelines right now. We're in the time when all of this work is being done. I think that we ideally sort of would have loved to be able to have our report come out and then determine what we wanted our legislative recommendations to be out of that report. And we will have an opportunity to do that in the next session. But for the 2026 short session, we really wanted to look at what are we going to be able to implement right out of the gate and draft up a legislative concept for the review of this talent council that we think reflects a lot of the work that's being done here and can potentially really kick off the work of implementation for the recommendations that you're all producing. So the majority of the concepts that we are including in this legislative concept come directly from the work of the Behavioral Health Talent Council, either directly from the action plans that you have worked on and approved, or from conversations that have occurred in this council identifying areas where we need to take action. Given the council's critical role in building our recommended roadmap to address the workforce crisis, the governor wanted to make sure that you all had the first opportunity to hear about and provide feedback on these concepts before it becomes sort of a larger conversation with stakeholders and legislators and such. So based on the conversations that we have all been having in this space, the governor's office policy team identified 4 concepts that will advance the work of the council. We're exploring bringing these concepts before the legislature in the 2026 legislative session in February. So first, we heard concerns about the cumbersome nature of CCO credentialing, the inequitable outcomes it is producing when CCOs hold practitioners to competing or confusing standards compared to OHA. These concerns arose in our discussions around streamlining licensing and credentialing in both the subcommittee meetings and full council meetings. So the concept that we are working on would require OHA to set up a centralized credentialing portal for behavioral health workers and require CCOs to use that portal for their own credentialing. That would create a single process for CCO credentialing that will be both more efficient and more equitable. Our team is currently exploring some opportunities to take advantage of existing systems that are already in use in other states. I know the state of Washington just recently implemented a system that has been used by some other states as well. And so we will have more detail on this particular item going forward, but we think that we've identified some really promising leads on how to implement this. Second, we've had consistent conversations within this council around the impact of administrative burden on our workforce, both in terms of morale issues with the workforce, burnout issues, and also in terms of the time that is available to them to actually serve patients versus the time they are taking to do administrative tasks. So this legislative concept would codify the reduction of unnecessary and duplicative administrative burden as a central part of the Oregon Health Authority's mission. It would require Oregon Health Authority to report to the legislature every 2 years and to the governor's office on what efforts they have made to solicit suggestions from providers to reduce burden and which of those suggestions they have actually been able to implement. So this will serve the twofold purpose of eliminating existing burdens and also giving the legislature the information that they need to minimize proposed new administrative burdens. Now, this is already based on the action plan approved from the Recruitment and Retention Subcommittee to reduce the administrative burden on providers. And we think that this concept is going to be a strong start to putting all of the other actions in that action plan to moving those forward. Third, the council has identified access to clinical supervision as a major issue facing people entering the behavioral health profession. So we are, through this legislative concept, directing the state licensing boards to develop rules allowing for any of their licensees to receive their clinical supervision from any qualified mental health professional, regardless of if their degree type matches that of the supervisee. This is something that's already being done under MHRA, that they have that language that supervision can be accomplished by a qualified mental health professional, and the boards will be able to do the rulemaking necessary to make sure that those people have the qualifications necessary to deliver the supervision that is going to be complete and competent and make sure that people are getting the supervision that they need, but make sure that there is not a barrier to supervision just based on the fact that the person's supervisor has a different license type than they do. Finally, we want to continue the fantastic work that has been happening at our licensing boards and that we talked about a little bit at one of our last meetings to improve licensing time and customer service. We also want to give those licensing boards the flexibility and the resources that they need to do all of their tasks of serving licensees, protecting the public, and continuing to pursue initiatives to equitably and safely expand the workforce. And I think that's something that we have recognized as there have been recommendations to the licensing boards. A lot of that work has already been stuff that they have either been doing or have been wanting to do, but without the sufficient resources to be able to sort of pursue those initiatives, it's more difficult for them to move forward on a lot of the things that we have been recommending. So the legislative concept would bring the Board of Licensed Social Workers under the umbrella of the Mental Health Regulatory Agency, where it would be joining the Board of Psychology and the Board of Licensed Professional Counselors and Therapists. And that will allow for greater coordination and access to resources for all three boards and access to the expertise of all of their staff. This is in line with work that the council has been doing to make licensure process easier and more accessible. So that covers everything in this legislative concept. Like I said, we really tried to identify the things this work group has been working on that are ready to go and can really make an impact on the workforce immediately. And at this point, we are happy to field any questions that you have for us or take any feedback on this legislative concept. As Danny pointed out, there will likely be an amendment at some point in this process. And so there is still time for us to incorporate feedback and continue to improve this legislative concept prior to introducing it in the legislature. Clarissa, go ahead.
Hi, Casey. Thank you so much. That's all incredibly exciting. Um, I'm wondering if this is an okay question to pose based off some conversations we've had with the umbrella term of behavioral health. And I noticed that in number 3, you had mentioned clinical supervision, and we had this conversation recently that it's not always called the same thing. And I've repeated this like so many times. I'm so sorry, you guys, but like when we're talking about this language, using the term clinical hours, so it applies to the medical side of behavioral health. I'm wondering if that's something that's being discussed or considered. And this was kind of a recent conversation, so I'm sorry to just spring it on you, Casey. But that there's this umbrella term of behavioral health, and I know I've said this to you, Casey, like there's this umbrella term of behavioral health, but that includes medical providers, and our clinical supervision is not even called clinical supervision. So like there's this language barrier, and we discussed maybe switching to the term clinical hours instead of clinical supervision. So I'm just wondering if that's something that can be incorporated or is being discussed, or if you have any knowledge of what I'm talking about whatsoever.
Yeah, that is actually something that we discussed in our most recent conversation about the legislative concept. It's something that the First Lady raised as something that's important to look at. And so we have that conversation happened, I think, yesterday. So we have not yet sort of
Awesome.
next steps, but it is something that is on our radar for potentially incorporating.
That's great to hear. Thank you so much.
Rachel?
Thanks, Casey. So I'll add just a tiny bit more context, but it does sound like the First Lady elevated and maybe tailored to the staff. One of the things that's been interesting is that at the Board of Nursing, when we approve education, when we provide approval of any school and training, there's no necessarily set hours or a standard that somebody has to have as clinical hours in any program. And I know not all programs are like that, but it was interesting to hear, as you know, in the subcommittee, what those in the behavioral health space have to go through when it comes to supervision after graduating, adding on this barrier versus what clinical hours do you get when you're in your training. And so it did seem like, in reflecting on past legislation that passed, there was potentially people left out of opportunities for grants because of the way it was described in this behavioral health space versus, psych NPs, doing clinical hours. And so I wanted to just put a finer point on that language, and it's the first time it's come to my level of understanding, being a part of this, of how different the pathway is for each. But really, there's so much overlap. And again, I don't know if we'd be the only state thinking about that or if it's already been done. But I do think since it it left some people out in the past and we recognize it here, maybe it won't in the future. If it is just described a little differently when it gets translated through OHA, whoever else it's gonna.
That is super helpful context, and I'm already seeing messages flying through the governor's office staff about next steps on how to figure out what that looks like for us. And just want to, since you have put your hand up, Rachel, just want to flag how fantastic it has been seeing all of the collaboration between all of our different licensing boards and all of the sort of work everybody's doing on sharing best practices and figuring out how they can sort of adapt each other's work and everything. So just calling out Rachel from the nursing board, but also Todd from MHRA and his staff, Ray from the Board of Licensed Social Workers has been a huge help in these conversations. And of course, Van and Eric over at MacBo. It's been really special as the staffer for the licensing and credentialing subcommittee to get to have all of these smart people working together on this.
Yeah, it was fantastic because, I think this talent council, did the things that we've always done, but then adding in this piece did help. And for those of you that weren't in the subcommittees to hear me, my shock and awe about how nursing is really supported in this way to prepare you to graduate and prepare. We have our own challenges with getting clinical hours and all of that, but we are in a position where we are supported throughout. And then you take your test afterwards and you are told you're ready, as opposed to all the stuff a lot of the mental health therapists have to go through, and your master's prepared, but maybe not licensed. And I just see such a big inequity of that. And I don't know what the answer is if we can do it by state, but it was just really enlightening.
I'm not seeing any more hands. Should I throw it back to you, Taylor, or you, First Lady?
First Lady.
The only so Kiki, when do people? I know people want to see, a legislative concept is a legislative concept, and so when do we get closer where people can kind of see, and how does that work?
So the bill is currently being worked on by Legislative Council, who are the people who actually write all of the legislative language and who are some of the scary smartest people I've ever met in my life. So they're the ones who turn our ideas into actual laws, and the due date for those to come back to us in their first draft form is going to be January 9th. So we don't know that we won't get it before then, but that is the latest that we will possibly get it. And after that, we will have legislative language that we can sort of work with as we look at potentially drafting an amendment and as we start to reach out to stakeholders and advocate for the bill.
Perfect. Thank you. I know people want to see it. We'll have more conversations about language when there's language to look at. These are concepts, and then you take a look at what comes back, and then I think they'll be like, what about this or what about that? Also, just know I can, the governor's staff could speak to this too, but just trying to figure out, in a tight budget cycle, what are some opportunities to make differences, but also being mindful about it's a tight budget cycle, and so. Just know that it's not all the things, but it's a start, and that's what we hope for. And so I think with that, unless there are any other burning questions, I think we are going to be out an hour early. I'm really excited about the work. Oh, Shira, yes. I feel like that coach should get a question because it's so good. You're on mute.
I have too many coats, truly, but thank you so much. I don't have a question. I just wanted to like express my immense gratitude for all of the work that has been done. We had like a lovely little debrief in our subcommittee meeting and just talked about, like just all of the time and attention and expertise that has gone into this work. And not to knock on any of the work groups or legislative committees or anything that I've ever been on in the past. And this felt very efficient and well structured, and like we have product and a path forward. So I just appreciate you so much, First Lady, and your staff and OHA and everybody else that's here. I really kind of feel like this was the dream team to like bring all of these ideas to life. So thank you for giving me a moment, but I just really appreciated being able to be a part of this.
Dr. Gates.
We're not going to turn this into an appreciation fest, maybe, but I also want to echo what Shira said, and just to say that in so many, I mean, I try to do this respectfully, but I have shared in so many different contexts just how well these meetings are run and how much we've been able to get done. I think last week I said these are the best run meetings I've ever been a part of, and I've been running meetings for 25 years, none of them this good. And I know the amount of work in the background that goes into that. So I just feel like all the choices and yeah, all the back end work that you've been doing to make this happen and to move from 6 months ago being in a room together. And I think the First Lady asked us to imagine like a magic wand and what we would, or like a superhero, I can't remember. Like I think I had a magic wand. No, we all had magic wands. Like here we are. I really couldn't have imagined getting this much work done in this amount of time. So, and it's just a testament again to the First Lady's leadership, to the amazing staff. And yeah, our subcommittee meeting was like our subcommittee was this high functioning machine by the end. I think Shali can attest to that. So anyway, thanks for this opportunity, and I'm super excited. And I do have a question, which is during the January legislative days, are there things that were implicit in sort of sharing that, like an ask from us or things we should be prepared to be doing during those days?
Do you want to field that, Danny?
Yeah, thank you for the question. I think those hearings move pretty quickly. So I think we will be in touch if there's a request around anyone participating in the panel that would be presenting on the concept. I think there's a potential opportunity there. I think that as far as just general advocacy around the legislation or any legislation that comes before the public hearing would be the best opportunity to show up, because usually that's the opportunity to actually present in a longer form. The only way that ever gets limited is if there's an excess of testimony and just limited committee time. So then you may be limited to 2 to 3 minutes. But I think as we know the path for the bill, particularly House versus Senate and committee, I'm sure support getting more information to the council and kind of guidance on how to show up and advocate in those spaces.
And I would just jump in. I'm going to call on Rachel Prusik, who was our former legislator. I do think I will, and I, married to a former legislator. I think I do think people are really interested in hearing from folks from their district. I think whether you're an educator or a community-based mental health clinic, I think that's really important. I think your expertise on the ground working with clients and students is really meaningful. And everybody's, especially in the metro and outside the metro area. And so I just would say, Rachel, if you want to jump in here, you're welcome to, in terms of what you think is helpful.
Yeah, I was just thinking about Danny's recommendation. I appreciate you giving me this opportunity, First Lady. But I think that if there isn't time for us to actually give testimony, given how fast things move and given the amount of probably intense conversations that are going to have with different budget cuts and different things coming from the federal level. Even if we don't have time to be in the committee and say something, you have the opportunity to post written testimony to be read, and that is super helpful, as well as, like the First Lady said, contact your legislator, your state representative, or those that are working here to say, hey, as a constituent, I've been working on this and this is what's coming to your committee. So both those things are super helpful. But since you handed the mic back to me, I want to, when you said the magic wand, I was like, that is exactly what she had us do. We had to use a magic wand. And I said I was going to remove admin burden, which is why I had that emotional reaction at the last meeting about admin burden. And it all came together. So yeah, I think all of us have put so much energy into this, and that means now people hear from us because it's going to be a governor's bill. But what does that mean? It also means all the work that was done behind to get it. It was a very public process from people on the ground, on the front lines with experience.
Thank you so much. And I think just the last thing I would add to our the other thing for the agencies, for licensing boards, this also is a partnership where it creates, OHA, they're, deeply committed and they want to reduce admin burden too. And this can help create a pathway. Sometimes, unintentionally, legislators can layer on things, and over time we have to go in and look at that. And so this also allows agency for folks who run agencies, this gives them permission to really be a part, continue to be a part of the solution, which is what they want to be doing, and provides direction and a runway to do that. And so if there's not anything, this has been lovely. If there is not anything else, our next meeting is going to be January 8th, from 2 to 4. As always, you will get the agenda in advance. Reach out to Chad if you haven't received it, or if you have any questions. You're going to get a survey, and I do want to be clear about the survey too. As you the report will go to the governor, and it will be an education tool. So when we think about the feedback, I think examples are really helpful. When people talk about this is what, and I've heard those throughout these meetings. I've heard them in the field. I'm sure you've had gold in your subcommittees. And so if there was something that you heard that really crystallized something for you, it's going to do that for someone else. And so just want to offer that up. And so Hannah, there'll be something coming from her, but if there's something you heard that you were like, oh yeah, that really explains that well, that's something we want to put in. So it is, there will be data, but there will also be the stories that really kind of deepen our understanding. Okay, well, happy holidays to everyone. Look forward to seeing you in the new year, and you take care of yourselves.
Thank you.
Thank you.
Thank you.